everybody. This is Dr. Gina, and I want to be talking about adapting during this time of pandemic. I did a video earlier, and it wasn't very good. It came out blurry. So I'm trying again, and I just decided to go live. How are all of you doing? This is a crazy time. You know, I've got some patients that are just acting like everything's just fine and going about their life. They don't wear masks in. I have to ask them to put masks on, and then I'm doing telehealth with other patients that are scared to death to go outside. So I thought about the idea of adaptation. What is that adaptation? It's where we begin to make changes because of environmental or situational factors. Sometimes though we have what's called forced adaptation or choice adaptation. And which do you think we're in? We're sort of in a forced adaptation. That means that the situation around us is out of our control. We didn't choose to be in this situation, and here we are. So to not become a victim, so what is a victim? A victim is a person that feels helpless, hopeless, and trapped. So how many of you are feeling helpless, hopeless, and trapped? A lot of people are. Guess what that does? That causes a brain freeze where you don't have any ability to make choices because that area of your brain isn't working. So the power of choice is really significant. So choice adaptation is kind of like when I went to Oral Roberts University and I chose to go there, but then I had to adapt to wear dresses all the time. They don't do that anymore, but they used to. It was very cold having to wear dresses all the time. So this isn't our choice. I mean, I don't know anybody that's like, yes, I want a world pandemic so I can be locked in the house, never know if I'm going to end up in the hospital or not. No, it's pretty forced. So I've adapted a few things. Like I first started with that hefty mask, the N95 or whatever it was, and it was really hot. And then I went to a lighter mask, and now I have a see-through plexiglass mask that adapted really well. So I feel less breathless and people can see my face. Part of that was a result from my patients being like, I'd love to see your face, and it was a new patient, so I realized, yeah, my expressions are fairly important to be successful as a therapist, so that is a good fit and a good adaptation for me. Figure out some ways you can adapt and the ways you do have choices instead of all the choices you can't make. Focus on the choices that you can make. Anyway, this is just a little food for thought. Have a great day. This is Dr. Gina.